because the department would like us to inform them on some of the strategic directions, how they're working, and where we believe the new department needs to go. I recently heard Mr. Lyons speak at a conference, and it's been a year, and we know that change takes time, and so we're all very patient, but we do appreciate the opportunity for input, and we have been asked.
Can I follow up? I'm sorry.
You certainly may.
From the actual client standpoint, have you heard feedback from our constituents? Or I know I get a lot of calls in the office, but I don't really know, being in the first term, don't really know what the situation was prior to the merger. So have you actually heard from clients, from people trying to seek services? Has it changed at all under the merger? Are we still going through some of the birthing pains of the merger?
I believe we're still in the early stages of the merger. You know, I think for many people to understand the entire department merger, they're just interested in can they walk through the front door and get the services that they need. And I believe in Oakland County we've had a really good relationship with our public partners as well as private partners. There's always room for improvement, but we have invested in the old Department of Human Services, MARA workers, which really allow us to speed up the receipt of Medicaid benefits or any other benefits that people might have. So perhaps at a local level, we've been working in a good way previously to that, but we do know that we have to carve out some time to sit at the table and really talk about where are the efficiencies, where are the redundancies, so we can achieve the efficiencies, because we are all one big department. Perhaps that's not the answer you hope to hear, but we're working on it. And I think that's important for you to know. Yes, Senator Marlowe.
I view everything by first of all, I'm in my 11th year in Lansing, and I view everything by, if we increase the calls into the office, the emails into the office, or is it just the same pretty much as before? And right now, it's about the same as it was before. I don't see an increase. You have to realize that we're merging 14,000 employees into one system. 7 computer programs have to be able to work in one employee's laptop when they're working with a client. That's where my big concern was. It was my big concern from day one when I was shocked that we were merging the 2 departments. But you know, we're moving in the right direction. We're not there yet. The computer is still going to be our Achilles heel. And I can only tell you that we had I think I got the initials right. I'll give it to you the way I think it is. I think it's NSIA is handling the payments. And I know that we're in the midst of contract negotiations with 3 other states. 1 state is on board now. We put this in the cloud. Some of us legislators thought that this would be a revenue stream. Unfortunately, you have to remember that this is on a 90-10 and we're paying the 10%, so we're not going to get a whole lot from the other states. It's not going to pay a whole lot of bills, but it's one of the things that we're going to be taking a leadership role. Back to your question, I'm almost positive that part of this could be the office where the patient was might not be quite yet hooked up electronically, and so that might be taking some of the problems. I can tell you that I have a I've got an allergist. Doctor and I both go to the same guy, and he's got a wall as big as that with charts, and he's going to be the last man on this earth in Oakland County to switch off of those charts. And every time I go in, I go, man, I'm sticking my arm in the target, because he doesn't like what came with the Affordable Care Act and electronic records. But again, the faster this moves into that age, the faster these payments are. One of the things that I was impressed is we had a conference last week up in Traverse City. Some of the people from his organization, this NASA, was in Georgia for a conference, and the state of Georgia can qualify a new patient in 45 days. I'm proud to tell you that we can identify a patient in the state of Michigan in less than 5 seconds. And that's how fast this computer is working now that it's up on the cloud. So, I mean, things are happening, and if we need to work together on finding out what that electronic thing is that's not working right, between Tim and I, we'll get you the answers, okay?
Thank you, Senator, and certainly we all know technology is at the hub of everything that we do now. I like to say to people, and I apologize for my redundancy, I'm a social worker by trade, but I've certainly had to understand finance and business to be where I am right now. And quite frankly, because of the requirements of collaboration and coordination with grants, we see a lot of collaboration happening because we all look for alternative funding. And we've got some really incredible things happening in Oakland County with provider organizations, with our other public partners around trauma-informed initiatives. Thank you, Easter Seals and others for that. Suicide, youth suicide prevention. We've got some mental health first aid happening in the school systems. We can't forget the schools. And we have some great partnerships there. We certainly need to step up all of those partnerships to get where we need to be. But really, quite frankly, we often find with the requirement of the funding and the collaboration, it really brings us together in ways that create good outcomes for people, but also we grow in our collaborative experience. So I've learned that you really do have to follow the money because that's where things happen. Yes, the vision is important and you all have to sort of row in the same direction to really get where you want to be, but we know that money drives it. So we look for alternative funding, we look for how we can work together to really get the outcomes at a good, efficient cost. I sound like a business, but this is a human service business, and again, I'm going to be redundant for some people. I like to say that if we don't learn to be good business people, we'll cease to exist to do the good things we want to do, and I think that's really important. So I will not downplay the human service side, however, in the public safety net. It is a little bit of a different kind of business, but a business nonetheless. Any other questions? Yes, Lois.
More of a statement. I sit on the CAC, which is the Consumer Advocacy Committee, and I sit with Pam, and I'm honored to sit with her. She's been a tremendous advocate. But we talk about the cloud, we talk about the merging. There's such a crisis going on here. When you listen to the numbers, and I don't know how, it's so hard for me to sit here and listen to those dollar amounts that these people are getting. And the spend down is, to me, it's just ludicrous. I understand the historical perspective, but we've got to work on a way to do something about the spend down. This isn't months, this is days. And the woman that spoke about the people in Pontiac, these are their lives, their children. We cannot wait one more day. We must do something about this. Reform, working to get the general fund. Oh, I just beg you to please take this priority.
Thank you for that. There is a sense of urgency certainly with that, and that's why we have a statewide committee. I know that Pam, actually I invited Pam to join us. She sat in on the teleconference that we had. It was our first experience with the committee, I believe, within the last couple of weeks. So we hope to have an influence on that committee and create some change. But you're right, there is a sense of urgency because as we stand here, sit here, people such as Pam and others, not only in Oakland County but across the state, are experiencing the spend down issue. And for those folks who don't know, there are states that do not have a spend down. It is a state issue. And if we can't change the spend down paradigm, then at least can we change the formula so that if you hit a certain amount of income, you don't jump from $100 or $200 spend down to a $600 spend down, which is really, as you say, ludicrous and makes life unbearable. How can you live with that? And it's certainly people who experience issues, people who do deserve our attention and our support. Yes, Helene.
So my question is, you just brought it up, what are other states doing regarding spend downs? Is that state policy that creates that? How does that come about?
Yes, it is state policy, and we're looking at those other states that do not have spend down. Once you qualify for Medicaid, you qualify. There's no deductible in the vernacular. Spend down's a little different. It is really a deductible. So we're looking at that, and we'd like to propose that on a statewide level, or as I said, at least change the formula or the algorithm on how do you configure somebody's income that they end up with a $700 deductible a month. That's not even a year. We're talking $700 a month, which is really quite prohibitive. So, any other questions, thoughts, comments? Yes, Senator.
I just want to make one more comment. As you worked with patients and clients, I want to remind you that we're 37 days into having Healthy Kids Dental in Oakland County. We're the last county to come on board. It was one of my priorities, putting it in the budget. And I apologize we couldn't take it, as all the other state counties have it, to the full age of 18. We're only out to age 12 because that's all the money I had left. But I can guarantee you that next year I will go from 12 to 18. First thing that I have the opportunity, if I can find the funds. But I'm a firm believer that a lot of things can be found within a patient to the oral cavity. And I can't imagine being a student sitting in school trying to learn and having an abscess tooth or something of that nature. So again, if you have patients, and I'm not even sure if the dental industry knows that it's coming. Everywhere I go, I was just at the dentist. I said, getting anybody calling? No, nobody's calling. And I said, well, they'll be calling as soon as they find out. So pass the word along. I think it's important.
Thank you. I guess I probably should give you some numbers of the $12 million in general fund that we currently have. Our past history is that 8 to 9 million of that is used to support people in Oakland County to help them meet their spend down. Obviously, with a $12 million budget, we can't use all those dollars. We have other imperatives that we use general fund for. Some of them assist in jails and jail diversion and those kinds of things, which not only are important to do and are the right thing to do, but we are expected to do per our contract with the department. So we do have competing priorities for the general fund dollars that are left to us. So of those general fund dollars, again, we can't continue to use the 8 to 9 million dollars. The other thing I want to clarify is the people who are being transitioned from our services are people who have moderate needs. We will continue to support folks who have higher level needs, more severe needs, people who need intensive supports, and we will continue to pay the spend down for those individuals because we believe if we don't continue to support them, they could very shortly end up in an emergency department. That's not death or hospitalization, and that's certainly not to downplay the need of the people that we've identified for exiting our system. It's just we have had to prioritize and make some very tough decisions, and none of us are happy about the decisions that we've had to make, but they've been made nonetheless. And again, not only in Oakland County, but across this state. This is a statewide issue. Yes? Pam, do you want to come up and speak?
I'd like to mention, I go to our house clubhouse, and I came across a situation which I think many people would not even be aware of. One of the members at the clubhouse has a partial extra help subsidy for the Medicare prescription drug plan. Once you have Medicare, even if you have Medicaid, Medicare is the payer for your prescription drugs. Because of his income, he only has a 20% subsidy for his medications. However, because he met his Medicaid spend down earlier this year, he gets the full extra help subsidy. And we went and looked at the situation. If he did not receive the full extra help subsidy, his medication copays, monthly copays, would be over $700 a month. So therefore, this individual who has severe mental illness and many severe significant health problems would not be able to afford his medications without meeting his spend down either. So I just wanted to let people know that, because of course, if people can't get medications that they truly need, they're going to become ill and not be able to function. So, thank you.
Thank you, Pam. And please know that if you have questions or comments, it's not just for me. We do have Pam and Kathy sitting at the table. So, are there any other questions or comments? We're at the end of our breakfast together again. So thank you. I do appreciate you taking the time from your busy schedules, all of you, not just legislators, and I certainly know your schedules are packed, but all of us where we sit are very busy people, and nonetheless it was very important that we come together to meet each other, get to know each other better, feel comfortable with each other, probably knock on each other's door and get some more information. But this kind of event we do intend to continue into the future. As I said, it was last held in 2011, and I think it's good for us. I hope it has been good for you. Thank you very much.